At HB Pharmacy, we've been getting a lot of questions related to weight loss injections, GLP-1s, compounded semaglutide, tirzepatide, all under the umbrella of millions of questions. So today we have our pharmacist, John, who's here to answer some of those frequently asked questions that we get related to weight loss injections. So John, I guess first and foremost, why are compounding pharmacies allowed to compound this all of a sudden?
That's a great question, and nice to see everybody. Glad to be here talking to you about this subject. The issue came up because it became unavailable. It's on a back order, and the only reason we're legally allowed to compound these medications is because it's officially on the FDA back order list.
Okay.
That's literally the only reason.
Okay, and for a quick backtrack, a compounding pharmacy, unlike a traditional retail pharmacy, in a compounding pharmacy, the pharmacy actually compounds and creates this medication themselves from scratch using the active ingredients or whatever other ingredients they need to put in to make it in the relevant form, right?
Exactly, and there's a lot of oversight, there's a lot of compliance that goes into making sure that a pharmacy does these things properly.
Sure. Now, that said, have any pharmacies gotten in trouble or have there been any issues since this all of a sudden is on the back order list and now pharmacies can compound it?
You know, yes, to answer your question briefly, yes, 100% there have been some issues. And just like with anything else, there are people out here that are just unfortunately looking for money. And they're, so in short, I think there was just recently in the last month, 11 pharmacies shut down because the product that was inspected was not what was labeled on the vial. And in fact, some actually were just giving normal saline. So they were not even, so they're paying God knows what, and they're getting, just saline. So listen, there is that, I guess, placebo effect, but even still, that's just.
So as a patient or a consumer, then, what can we do, or maybe what kind of questions we can ask? Like, is there anything to make a more informed decision for a patient on which pharmacy to trust? Or I know there was an issue with the salts or whatever that they were using.
Well, yeah, there's some questions and there's some due diligence, and again, there are a lot of good people in this industry that are doing good work and that you can trust. But you can have a conversation with the pharmacy. You can ask them, for example, are you using the pure form of the medication, whether it's tirzepatide or semaglutide, or are you using a salt form like semaglutide, acetate, or sodium? They shouldn't be using the salt forms. They may not be as effective. Those weren't the original medicines tested, and honestly, those aren't the things that we're approved and allowed to do during this special situation of an FDA back order.
Okay, so what else then can they ask beyond the salts? Like, I know in our compounding pharmacy, for example, we do some batch testing or quality testing. Is that another thing that a patient could ask?
Right, and so now for compounds, as a rule, we do skip lot testing so that periodically a lot will be sent out for testing to make sure a capsule contains 100 milligrams of, if that's what it's supposed to contain. For these GLP-1s, these weight loss drugs, every single batch is sent out for testing to Eagle Analytical in Texas, and that batch is quarantined or held until it's cleared. So that's a substantial amount of cost. But the idea here is, you're trusting us the patient is trusting us to make something. We want to make sure that we're taking every possible step to make sure that they're getting that's something that's sterile. And that's at the potency that it's supposed to be at.
Sure. So while it may seem a little bit like the Wild West, especially if you're unfamiliar with the compounding world, there are many pharmacies out there, compounding pharmacies, that take quality and regulations very seriously and are doing these things in a safe way. And you can also probably tell by just, a Google search and looking at reviews and similar things like that.
For sure. But you can tell, and again, there are plenty of good people that are out there doing the right thing. But when they have a commitment to make sure that they're giving it like that with the testing, then that place is a safe place to get the medication,
Now, pricing-wise, how does this compare to the brands and typical medication before this went on the ban list, or not ban list, the yeah,
it's a back order list.
order
Yeah.
list.
Yeah. Again, so you're some of these medications cost as much as $1,300. There are manufacturer
For a
coupons.
month supply, right?
Month supply, $1,300. Depends on which medication we're talking about, but even with manufacturer coupons that reduce that, it's still still significantly high, $800 and plus. So you can expect to pay half or even less than half for these compounded versions. So
Okay.
so it's a significant savings.
Sure.
And it's not only about the price here, because again, we want to make sure that they're getting a quality product, but you can save a substantial amount of money.
Sure. Now, one thing that we have always talked about at HB Pharmacy is, hey, you don't necessarily want to be on medication for the rest of your life, right? So is this something that you need to take for the rest of your life, or what other kind of lifestyle changes can you make in addition to taking the medication?
So, one of the first things I like to tell a person is you're coming. So there's some people that take this because they're diabetic.
Sure.
Okay, and they're trying to lower their A1C, and if you're diabetic, you'll be familiar with that. But if you're doing this for weight loss, I like to try to tell people use this as a short-term thing to kind of jumpstart your weight loss, right? And while you're jumpstarting your weight loss, you start doing other things in concert with this, things like increasing your level of activity, increasing fluid levels like waters, maybe extra water, perhaps obviously looking at your food choices, right? All those obvious things. So this way you get a jump start, you start losing weight, but then you're also doing these other things, and with all those things together, you're actually getting goes closer to your goal. So that maybe you do set a goal, and so maybe 6 months in, maybe a year, you can look at that and say, okay, that's what I'll be. I don't think you should think about it as that you should have to take this the rest of your life. I wouldn't want to say that.
That's good to hear. That's good to hear. What about side effects now? Are there any kind of side effects that are commonly experienced for patients taking this drug?
So side effect wise, most common side effects are, initially, especially as you move up into the higher doses, are a nausea, right? Where you just get this involuntary situation where you might just want to throw up or feel like you're going to throw up. There are medications you can take that combat that, ondansetron, for example, sublingually. A lot of people get constipation, so I recommend to people to take a fiber capsule, and I also recommend increasing your fluid intake and maybe using a product like Miralax if you have these situations develop. Now, listen, there are other things we don't know in some of these cases. Side effects are often dose dependent, right? And so the lower strength that you can use on this medicine without absolutely having to increase, because there are levels of different strengths. If you can use a lower dose and you still lose weight, I recommend you do that, not necessarily just automatically go up and increase the dose all the way. But we don't know long term if somebody's on something 5 years or 10 years exactly what's going to happen. So we're concerned about those types of things. And there's certain people, particularly as people that have some thyroid issues. So nothing replaces sitting down and talking to your pharmacist or your healthcare practitioner to discuss exactly what's going on in your particular case to see if this is an appropriate therapy for you. So while this video may be informative and interesting to you, it's not a substitute for you consulting with your healthcare practitioner to discuss the side effects. But as far as we can tell, so far things have been, it's been well tolerated and it's been extremely successful. Patients are enjoying good weight loss.
Makes sense. Now, what about for people who may want to experience said weight loss but are a little bit afraid of the needle? Is there any kind of option like that?
So something we're looking into now, and we're hoping to roll out with a new formulation for sublingual version of this, which will obviously be used daily instead of once a week, which the injections are used. This sublingual version, will hopefully be as equally as effective. Then you won't have to deal with the refrigeration aspects of this medication, and nor will you have to deal with the actual injection. So yeah, that's coming. So stay tuned to HB Pharmacy's channels and our social media channels to find out more information about that.
Awesome. Is there anything else you want to add before we wrap up about tirzepatide, semaglutide, or all the above?
I just think if you're going to make the commitment to do this, and you're going to take the take that on that expense, get resolved to yourself to say, okay, I'm going to not work against myself. I'm going to do all these other things in concert again with the injection, so that you get the maximum benefit. Otherwise, it's not worth your time and all the money you're spending. So, because, why take the medicine and then just continue to eat the way you were
Agreed.
doing, stuff like
Yeah,
that. I think that's my final thought there is, and then set some goals so that you can realistically see what you're doing. If you don't measure something, it doesn't necessarily get done. That's an old saying, and in many ways, people say that if it doesn't, what gets measured, get done. So weigh yourself, once a week, check in how much what you're eating, and see how you're doing. I just want you to be successful if you decide to take this route, and also do your diligence when you pick a pharmacy. Make sure you're looking at a pharmacy that's responsible, perhaps a pharmacy that's accredited, for example, and be careful who you're dealing with, because there's a lot of online places or commercials on television now. Choose carefully.
Makes sense. Yeah, great advice. Thank you for your time and for answering these questions, John, and thank you all at home for tuning in and joining. Like John mentioned earlier, I just want to reiterate, videos like this, while informative, don't replace that one-on-one interaction you would have with your local pharmacy or your provider as well, your doctor, and whoever is going to write this prescription for you. So please make sure you reach out to someone to have that conversation and determine whether this is right for you and a good fit for you. And of course, as always, if you have any questions, you can call us here at HB Pharmacy at 201-997-2010. Thanks.
Thanks.